What's up, everybody? It's your boy Patrick. Oh man, it's an honor. Someone I honestly look up to. This is a Western alum, someone in the game who's a titan, especially in the social media, like with over like 33,000 followers, right? But as a Filipino as a great representation of the Filipino and Filipinas, you are like a star, and it's like super cool to have you here, sitting in Arts District, Los Angeles. We out here. But without further ado, I'm here with Dr. Veronica Velasquez, man. This is wild. Thank you.
Thanks, Patrick.
Yes.
I'm super excited to be here and just to talk with you and just tell you all my thoughts.
No, exactly. And that's the reason why I have you here, because selfishly, as a new grad physical therapist, the first person I thought would be an amazing, resource. So that's something I want to do, is utilize my resources, and you're the first one I thought about. So today's all about you. I'm just going to be here vibing. I'm going to be listening as a fan, and I'm just really thankful that you're here. So if it's cool with you, we're gonna just jump right to it.
Love it. Yes.
Beautiful. So please tell me about your journey and how you became a PT.
So I think I'm Filipino immigrant, and so there's a lot of historical implications here, but I'll go over that. I'll not go over that.
Yeah.
But basically, my parents really encouraged me to go into healthcare, medical field type of work. My mom was a nurse, or is a nurse still, and they really encouraged me to go through the sciences and things like that. But something in me was like, I don't want to be a nurse. I want to do something a little different.
Right.
And I didn't sway too far from it. And I kind of discovered physical therapy. And it took quite a while. In community college, I did take a few classes in the athletic training program. I thought I wanted to be a physician at one point. So I really searched what really aligned more with what I'd like to do every day. And for me, I ended up doing a shadowing opportunity at an outpatient physical therapy clinic. And I went there and I was like, wow, this is cool. You just really get to be one-on-one with patients. I loved getting to just conversate and just talk with patients one-on-one. So from doing multiple hours shadowing a physical therapist, I just really thought that this was the way to go. So through community college, I transferred into Cal State San Bernardino, got my bachelor's in kinesiology. I also minored in gender and sexuality studies. And from there, I applied to multiple physical therapy schools and got into Western U. Yeah, and really had a great time there. And just spent 3 years there and graduated in 2019. And I've been a physical therapist for 5 years now. A little less than 5 years, but let's say 5.
That's amazing. Time flies.
It does.
Yeah.
It really does.
I appreciate you sharing that. That's awesome. So coming out of school, what was your first job as a new grad?
So I was an acute care physical therapist. I worked at a small community hospital in Compton. It's called Martin Luther Community Hospital. And so since then, that's one of 4 hospitals that I've worked in since then. So, that was my first ever job as a little baby new grad.
Okay. So it's been just in acute care?
Mainly, I've also dabbled a little bit in home health physical therapy, just to add on a little more cash on the side. But so I have experience there, and I really love home health. It's just I'm not a big fan of driving is the only thing.
Fair.
But I also love home health as well, so I have experience there. And funny thing is, I don't have experience yet, but on Monday I will actually be talking to a director of rehab for a possible telehealth PT job. But TBD on that.
Let's
TBD.
go.
Yeah.
Okay, congrats and best of luck.
Thank you. We'll see how it goes.
Like I said, it's an honor. Just killing it. Okay, nice. All right, beautiful. So where are you currently working at right now?
Right now, I'm working at a trauma level 1 hospital. It's called Harbor UCLA.
Okay.
Yeah.
Nice.
I've been enjoying it so far. I've been there over a year now.
Love that. Appreciate you sharing that. In regards to new grads, right?
Yes.
Stepping into the field, what is something that, I mean, this is a very broad question, but what is something that you didn't know coming in?
Ooh, a lot.
Yeah.
I mean, the first thing, and this is something I'm like pretty passionate about because I think maybe this is something that schools have lacked in like empowering, I think, new grads to really know that they're actually like worth a lot. You went through all of undergrad, you went through all of graduate school and passed the boards exam. You are such a valued individual that I don't think that new grads should be paid as low as I've learned a lot of new grads are getting paid. I wish that I knew how to negotiate. I wish I knew how to have the confidence to say no to some offers and be okay to let employers and kind of get nervous about losing us as candidates because I think like we're so highly underpaid. And it's a sad thing, and it's not good for the profession as a whole that new grads are getting paid so low and being exploited so much as workers because in general, if we look at all of physical therapy, our wages have not really increased as a whole in general, and like as much as other professions like physicians and nurses are killing it, and I think a lot of it is just this lack of knowing that we should be asking more. And I don't know if there's a greater question on like should we be better at advocating for unions and things like more benefits for us, but something that I feel very strongly on is that I hope that new grads know like we should negotiate more. You should be asking for more. Don't think that this one job is it. Apply everywhere and have employers duke it out and say like, hey, this employer is actually offering me way more. What can you offer me? Because I think I'll go here because they're offering me way more. And having the confidence to do that is not something that was taught to us as new grads.
I love that. Honestly, I completely agree. I think that is very scary, to be like completely honest, because as a new grad, I mean, you've been in school your whole life. So when you're in the field, you're like, okay, I'll take anything at this point.
Right.
So, yeah.
And that's kind of like, I don't know where that came from. Like I did hear a lot like graduating out of school. So I think the conversation really needs to get started. Maybe your first year, second year, third year PT school to know that like, wow, look at all these classes I'm taking. Look at all this knowledge I'm accumulating. This is worth something out there in the field. We cannot shortchange the mountains of debt that we get, the mountains of knowledge that we have in our brains, and that we're all like great there. At least I can speak for Western. We are great therapists that come out into the field, and we should be paid, what we're worth. And I don't care about this language of, oh well, you're a new grad, you should be grateful that you have a job. I'm like, I want to squash all of that because like, no, you are now my colleague. Like I love talking to new grads, but I don't want to see you as like this new grad, like beginner level. Like, no, you pass the boards, you are competent. I trust you with patients. So you should get paid as much.
That's real. No, I appreciate that. No, and I think like, I mean, personally, for me, like, it's something I'm very transparent with, going through the whole process of becoming, after you graduate and that whole process of passing the boards, and just having your confidence kind of destroyed a little bit. And then you forget that you are a competent PT because you've went through 3 vigorous years of school. And on top of that, clinical rotations, and you've treated patients, So I think that transition from going to, okay, I passed the boards, now I'm going to be a working physical therapist, you kind of lose that swagger a little bit. So I think stepping into the, like you talked about, like negotiating and all that stuff, like what do you think your best advice is for someone who's looking for that job? What do you, I know you mentioned it, but it's like, do I just go for the first job available, or is it like, do I have to really find my need? Like, how do you kind of navigate towards that if you're looking for that first job?
The first job, I definitely would apply like everywhere and see, like that way you can begin to see a pattern in what folks are offering within that area. And then also, like you said, utilize your resources, like ask your classmates and colleagues, like, hey, how much are you getting paid? I think there's also this weird thing, not just in the PT world, but in all professions maybe, that we are not very transparent with our pay. And like if you go on my Instagram, I will tell you straight up like how much I'm making per hour, because that only improves the profession. The only people that don't want us talking about our pay is the employers. But we can really empower ourselves if we could just share like, hey, I'm making way more than you. You should ask your employer for way more. And you can like actually cite, hey, I have a colleague that is making $5 more than me. Can you match that? And they graduated the same year as me. We have the same degree. Why am I getting paid way less? So I think like talking about it more with our colleagues and our classmates about literally how much is your weekly paycheck or your bi-weekly paycheck, and not being so hush-hush about it. Like there's no shame in it. If anything, the shame is upon our employers that they're not paying us well.
That's true.
Because by and large, I think everyone is a great therapist. I just think like we have to like be more empowered ourselves and share that and share our pay with others. So yeah, apply everywhere and be transparent and ask around and see what the average pay is. And I would say be confident, ask for the moon. Like honestly, I say be so unreasonable. As I've asked very like unreasonable things like as of recently, and like I've had to like really teach myself, it's fine, like don't freak out. They're gonna have a interesting reaction, and that's fine. Like I've spoken to recruiters that I've even asked sometimes for $60-$70 an hour, and I just know that they're gonna bring it down a notch. So just ask for the moon, and they'll be giving you a little bit less, but at least it's still a lot higher than whatever they're always going to give you the lowest pay and see if you're going to accept it. So I would say never accept the first offer. Never. Like go back and forth.
I'm fired up. Okay, all right, I love that. Okay, appreciate you sharing that.
Of course.
You touched upon this a little bit a while ago, and this is a heavy hitter. And this is something personally for me, I've like, it's been very scary for being in school for, almost 12 years, and I've taken out loans, and, I've lived off loans. I'm a professional student. So now that I'm no longer a student, this goes out to, everyone who can relate. It can be very generic. It can be, just like a small step, but how do you even like begin to tackle student loans as a new grad?
Yeah, that was my big, and I feel you on that. I graduated with over 100K student loan debt, and I want to tell you all, it is possible. Like I graduated during the pandemic, and I don't know if this is super healthy, but I grinded it out so much. I'm down to like 12K in student loans. So it is possible. But it's definitely, I think the first thing I would really encourage folks to do, and I really wish PT school did this, is just learning basic financial literacy. I went on YouTube, and I'm so grateful for financial content creators that gave this out for free on how to budget, how to just know how to have a paycheck and have a surplus. If you have a surplus from your paycheck, I was throwing all my surplus to my debt, and that really like shaved things down. But that was, I only got that way through like educating myself with financial literacy. So if folks can just find free knowledge or go to your local library and just like check out just the Finances for Dummies book.
Right.
At the basic level, just knowing how to look at your checking account and just to see how much you make in a month. I don't think folks in general know how to do that. This is something that I think maybe like not just PT school, like, but talking about a lot of the U.S. education system, we didn't empower folks that are going out into the workforce to know what to do with that money once we get it.
That's true.
And so we are in a lot of student loan debt and maybe even like some consumer debt, like credit card debt. So yeah, empower yourself with that education. And if you're a new grad, like with trying to get a new job, ask your future employers, do you have any student loan debt repayment plans? Can you help me out with my loans? See what these corporations and these employers can maybe help you out with. You just never know. You can include that into the offer and the deal. But by and large, a lot of it is going to come from you paying off these loans by yourself. And so that's budgeting, knowing, and if you do need help, you know, there's sometimes financial advisors that are out there, but I never needed one. I honestly think there's wonderful financial knowledge on Instagram, on YouTube, that's out there for free. But yeah, it is possible. Like, I think it's entirely possible. It's just the information is not being given to us as new grads. Yeah, I hope I answered your question.
No, and more you did. So thank
okay.
you. No, it's scary. Like, you know, like in the moment as a student, there's nothing you can do, right? You have to be a student. You have to get your education, and you know, school's not cheap, especially in the undergrad and in grad school. And if you go to private or public, it adds up. So that's something, yeah, I wish we were a little bit more educated about. And, you know, that's where you have amazing people like you who are just an amazing resource. I know you don't do it for the clicks, like you do it because you actually care. And that's something I've always, you know, really looked up, you know, with you. So I'm definitely going to, you know, pick your brain with that, you know, especially after this. And I hope whoever's listening, you know, can feel comfortable reaching out to you, because it is a sensitive topic. You know, like I'm getting the notification, I'm getting those spam calls of like all these loan stuff. I'm like, oh my God, it's, you know, it's happening. I gotta pay it. You know,
I'm like, just block them.
Yeah. So I can breathe a little better knowing that there's people like you. So thank you. Cool. Appreciate that. Yeah. All right. So now we're talking about a very popular topic as well, and I'm sure we've all heard it, but it's imposter syndrome, right? So just being a student, you know, in any program, you're grinding, you're doing your thing, your practicals, and then you are in clinical rotations, but now you're actually like that, you know, the man, the woman, like, who is calling all the shots as a clinician.
Yeah.
How do you like navigate like just that whole process? I'm not sure if it's like there's a timeline of when you stop feeling that imposter syndrome, or if you currently still feel it. But how do you, like, personally, how do you know, navigate through all that stuff?
That's a super real emotion that I feel like I felt, and then still kind of feel. Like, I'm 5 years in and I still feel that way a lot of times, because you're around a lot of really smart people. There are really great clinicians out there, and sometimes it can be intimidating. Like, you know, 5 years is not a long time compared to someone who has been in the profession 20 plus years.
Sure.
And so I would say to that, never, I heard this quote, and I don't know who to credit for this, but never compare your chapter 1 to someone's chapter 21.
Love that.
You just cannot compare that. And I think like this is something, personally I'm in therapy, so like I'm gonna share what my therapist has
Love
often
it.
told to
Love
me.
it.
Give yourself that grace. Because like even though like I am saying like empower yourself, you are a working clinician, you are still a new grad, and there's still so much to learn. And I think knowing that and just accepting that you're just going to keep learning as a clinician, right? They call us lifetime or lifelong learners for a reason. And I think it's impossible to expect yourself to be at such a high caliber as a new grad. And so I think my biggest thing that I would have told myself is that it's okay. Like if you don't know anything, I'm sure you have all your notes and your laptops and everything, and this is not a practical, this is not a test. You can go back to those notes. You can say, hold on, I kind of forgot the answer. Let me just go back to my reading materials and I'll get back to you on that. I think what I really want to dispel too is the education system is so focused on grades and so focused on high achievement that we're so scared to fail. We're so scared to not know information. And so I hope that we begin to change the culture to be like, hey, this is a new grad. How can we mentor them into becoming great clinicians? Right. How can we make it okay that they don't know everything? We don't, like, no one knows I'm 5 years in and I swear I've worked in 4 different hospitals. I'm still learning things every day. I'm still Googling things every day. Because I don't know where my notes are now at this point, to be fair. And that's okay. And I truly believe, I think I'm a great clinician regardless of how much is in my head. Right. I think you're a great clinician if you can admit that you're wrong, if you can hold accountability and just be like, hey, I don't know this, but I'm gonna know this. I'm gonna get better at this with the next patient. I think that is the mark of a great clinician. I don't think the mark of a great clinician is someone that knows everything. Because sometimes those are the clinicians I stay away from because they have sometimes a superiority complex, and that's not how we can usher in better clinicians. We have to give them grace, and we have to create really a learning environment, even in the clinic, even in the hospital setting. So yeah, I think it's this cultural shift, but that needs to happen in a grander scheme. But at least for the individuals that are watching this, please just know that you gotta just be kind to yourself and just know that you're not a machine. We're human beings. And are you kind? I would just say, if I were a CI or if I were a colleague, are you kind to your patients? Are you kind to your colleagues? Are you trying to do the best you can to provide the best care that you can on that day? If the answers to those are yes, then you're a wonderful clinician and you're gonna keep growing throughout your whole career.
I love that. Dang, dude. Chills, man. Sheesh. No, I love that because I feel like that is a very important mindset. You have to go in not thinking you're going to know everything, because in reality you're not. And I think that's the beauty of this profession, or just in general any profession, is you're going to be a lifelong learner. So if you go in with that mindset of hey, I'm ready to learn, but I'm very confident in who I am as an individual. Sure, I don't have the years as this person, but I'm ready to learn. And if you love what you do, and you're just a good human being, I think it'll be okay. So I really I appreciate that, because man, there's a lot of information. It's funny because I have a PT page, and I make sure just to follow a bunch of therapists, athletic trainers, a lot of people in the healthcare field, and it's overwhelming because you're people are posting their own individual content. It's man, how, I need to know these things. I don't know this. It's I don't know anything. So it could be overwhelming, but it's oh no, it's not like that. This is where you learn. That's where social media can be a good platform, a good resource. So Yeah, it's
And
real.
to your point, I think we also have to dispel this notion that we have to know everything.
Yeah.
Like, oh man, you don't have to know everything. I think it's like so cool that, and that's the beauty of content creation too. They're sharing, other creators are just sharing their knowledge just because they want to share it
Right.
and like hope this helps. Like they
true.
just want to make the profession better by giving this information out for free.
Right.
And there's no, we're outside of school now. There's no requirements. There's no grades that
There's
we
no
need to-
77% you have to
There's
get. It's
not.
like-
No. Yes.
Yeah.
It's great.
Yes.
Like, see, you made it. So,
Yeah,
like,
yeah.
honestly, like once you've gotten through the school system, you create your own
Yeah.
system, and
That's real.
yeah.
I love that. Dang, that's bars.